evening, and welcome to Smart Start for 2018, Goal Setting for Your Wellness. This webinar series is brought to you by Can Do Multiple Sclerosis, the National Multiple Sclerosis Society, and the Multiple Sclerosis Society of Canada. My name is Laura Coyne. I'm the Programs Manager for Can Do MS, and I will be your moderator this evening. Can Do MS delivers health and wellness education programs to help families with MS thrive. Please visit the Can Do MS website, mscando.org, to learn more about Can Do MS's online and nationwide in-person programs. Can Do MS is excited to partner with the National MS Society to bring you our first webinar of 2018. The mission of the National MS Society is to help people affected by MS live their best lives as they stop MS in its tracks, restore what has been lost, and end MS forever. You can explore other societies' programs, services, resources, and connection opportunities at nationalmssociety.org. Our speakers this evening are Stephanie Buxhoeveden, Peggy Crawford, and Mandy Rohrig. Stephanie Buxhoeveden is a neurology nurse practitioner and co-director of the MS Center at the Neurology Associates of Fredericksburg. She specializes in the care of people living with MS, Parkinson's, Alzheimer's, migraines, and epilepsy. She also writes for several publications, serves as district advocate activist leader for the National MS Society, and is on the membership committee for I Conquer MS. Peggy Crawford is a health psychologist who has specialized in MS care for over 25 years and has been affiliated with the MS Center at the Cleveland Clinic, the Can Do family, and the Department of Neurology at the University of Cincinnati Medical Center. Peggy has just relocated to Bath, Maine. Mandy Rohrig is a physical therapist and currently works in an outpatient physical therapy setting where she specializes in the rehabilitation of individuals with neurological conditions, with a special emphasis in the treatment of individuals with MS as well as balance disorders. She recently received her Multiple Sclerosis Certified Specialist designation.
Thank you, Laura. Welcome, everyone, to this evening's webinar. We're glad that you're joining us this evening. We hope everyone is cozy and warm on this January night. So we're going to talk about wellness this evening. The National MS Society and Can Do MS agree that there are 6 primary dimensions to comprehensive wellness, and this is for both people living with MS as well as the support partner. So let's start by going through these 6 dimensions of wellness that you see here. We'll start first with work and home at the top. Work and home would mean engaging in meaningful and rewarding activities that promote a sense of purpose and accomplishment. And this is using your talents and your knowledge for others, both at home, at work, and potentially in the community. Next is emotional well-being, and that is developing coping strategies to enhance problem solving, manage stress, encourage a positive outlook, as well as develop resilience in the face of very unpredictable challenges and situations, while at the same time acknowledging your mood and potential depression and anxiety issues. Next on the circle is spirituality. Now, spirituality may include religion, but does not exclusively need to mean religion. Spirituality can also mean developing a worldview. It can provide a sense of peace, harmony, and hopefully can enable one to cope and adapt throughout life with the ultimate goal of finding some sense of meaning or purpose. Cognitive well-being is next, and this is engaging in mentally stimulating and challenging activities. And cognitive well-being can lead to hopefully enhanced personal growth, creativity, and new learning. Now, my personal favorite as a physical therapist is the diet, exercise, and healthy behavior dimension of wellness. So that's making positive lifestyle choices about regular physical activity and exercise, healthy eating, weight control, as well as primary MS care and preventative health behaviors. And last but certainly not least is the dimension involving relationships. So this is developing positive, healthy relationships that nurture a sense of interconnectedness with the family, friends, and your community. So We acknowledge at certain times of your life you may feel like, wow, I'm really excelling in all of these dimensions of wellness, and I feel like all of these circles are really balanced. And at other times you feel like, MS or not, you feel like that's not the case, and certain areas need more attention. So let's go to this polling question. Which dimension of wellness do you wish to improve upon? So take a moment and think of the dimension of wellness that you would like to address personally. And as you do that, please note that we did not include spirituality in this question because we acknowledge that spirituality is very individualized and unique to everyone. So hopefully we'll get some results here. So hip hip hooray, as the PT, I'm excited about the diet, exercise, and healthy behaviors. Seems to be the dominating dimension people wish to improve, but overall a fairly balanced results. So thank you for your participation. So after the hustle and bustle of the holidays, an extensive sharing and giving to loved ones, which, don't get me wrong, is really lovely and joyful. January is often that time of the year we stop and think, and we start to allow ourselves permission and maybe even encourage ourselves to start thinking about ourselves and how we can optimize our wellness. So as we consider what we might strive to improve upon, please think of this shift of thinking not as a New Year's resolution, but rather a new habit that you hope to make a routine. And the people who can help turn those resolutions into habits is the MS team. So this next slide, you're going to see a nice diagram of our MS team. And it can include some or all of these healthcare providers. Some you may see consistently, and others you may see on a more as-needed basis. Fortunately, tonight we have 3 of these healthcare providers, the nurse practitioner, a psychologist, and a physical therapist on the webinar. Now, when we step back to think about the dimensions of wellness that healthcare providers can help with, some of them are pretty intuitive, right? So a PT would obviously help with exercise. A psychologist would certainly help with emotional well-being. However, it's very important to note that any member of this healthcare team can help both the person with MS and the support partner improve any of those areas of wellness. And I'm going to actually share a personal example. I had a client who was experiencing some challenges with intimacy with his wife. And he told me during one of his physical therapy sessions that this was going on. He disclosed and shared this challenge. And so I put him in contact with an expert nurse practitioner who worked with him on some medication changes and some other issues that ended up helping him tremendously. So I think the key message is that all of these members that you're seeing on this healthcare team care about your overall wellness. Even if it's not an area of wellness that we can specifically address, we can put you in touch with someone who can. And that's truly, I mean, that's the can-do way, and that's the optimal way. So putting your wellness aspirations into action with your team ideally involves applying this concept of a SMART goal. So SMART is an acronym for specific or targeted, measurable, attainable or achievable, relevant or meaningful, as well as time-based goals. So moving forward, the remainder of this webinar will involve tonight's MS team discussing 3 real-life examples of people with wellness challenges. And together we'll identify, problem solve, and set some SMART goals for their wellness issues. So without further anticipation, Stephanie will get us started on our first example, Karl.
Thanks so much, Mandy. Happy New Year, everyone. So we're going to start out by talking about Karl. Karl was recently diagnosed with MS. He's had it for about 3 years now. He's 30 years old, he's single, and he has a very busy job as an attorney. His primary MS symptoms include numbness, tingling, and weakness in his legs. But ever since being diagnosed, he's been really preoccupied with having MS, and as a result, a lot of the things he used to be passionate about, like going to the gym and spending time with his friends, have really suffered. He's feeling really anxious about what his future holds, and in general, he's just not as confident as he used to be. And as a result, he's having trouble shutting his mind off at night and getting good sleep. He also has an untreated vitamin D deficiency that we need to address. So the first thing we're going to do is stop and take a polling question. So in your opinion, which dimension of wellness do you think Karl should address first? I'm going to give you a minute to think about that. Okay, let's see what Karl should be working on. So a lot of you recognize that emotional well-being is going to be really important for him, and also diet, exercise, and healthy behaviors. I agree, those are two big ones. And certainly all the dimensions of wellness need to be explored with him further. So the first thing we're going to touch on with Karl is the quality of his sleep. And I just want to start out by saying sleep is a topic that I could spend easily an hour talking about, but we've got a lot of other content to throw at you tonight. So we actually have done an entire webinar focused just on sleep. And I encourage you to go to the Can Do MS website and look through those archives. And if sleep is a big issue for you, please do watch that webinar. It's really a great one. So a couple of things specific to MS and sleep. People with MS are more likely to have sleep disorders like sleep apnea and restless leg syndrome than the general population is. Impaired sleep is complicated because it can really be a medication side effect. It can be because of your MS symptoms. You know, if you have spasticity and pain, it can be really hard to get comfortable enough to actually fall asleep. And mood disorders, insomnia or difficulty sleeping throughout the entire night is one of the most common symptoms of mood disorders. So really, it's not just having trouble falling asleep, but it could also be having trouble staying asleep throughout the night, or just that you're waking up and you're just not feeling refreshed after getting what you thought was a full night's sleep. So if you're experiencing any of those things, you definitely want to bring it up with your healthcare provider, because there are a lot of things that we can do. We can adjust your medications, cognitive behavioral therapy is very effective. There are over-the-counter treatments, and as a last resort, there's also medications that you can use to help you sleep a little bit better. So on the next slide, we're going to talk about sleep hygiene, and these are just the basic things that everybody should be doing to optimize their sleep environment. Maintaining a regular schedule is really important to keep your body in sync, right? So that means going to bed at the same time every night and trying to get up at the same time every morning. We get into trouble when we are not getting a lot of sleep throughout the week, and then we try to catch up during the weekend, and then our whole schedule gets thrown off. We also want to make sure we keep our bedroom cool. They say like 65 to 68 degrees is optimal for sleep, that it's nice and dark, and that it's as quiet as possible. So if you live in a busy area, that's why white noise machines are popular, because it kind of drowns out that ambient noise. And we want to reserve the bedroom for sleep and sex only. You don't want to eat, you don't want to do homework, you don't want to be doing anything else in bed other than those two things, because your brain needs to associate your bed with sleep. Make a to-do list before bed. And this might sound a little bit silly, but really what keeps a lot of people up is when they lay down, they think about all the things they have to get done the next day, and they start worrying about it. So really, to put your mind at ease, keep a pad and a pen next to your bedside, jot down a to-do list. If something's on your mind and you don't want to forget it for the next day, write it down, and then you don't have to worry about it. And we're going to talk a lot about these things, but in general, we're going to avoid exercise, caffeine, smoking, and alcohol consumption before bed. All of those things make it harder to fall asleep. It can cause more insomnia, so you definitely want to be sure to avoid those. And if you cannot fall asleep, if you're in bed and you're trying the best you can and it's still not happening after 30 minutes, get out of bed, because you're just going to get frustrated and fed up that you're not asleep. Go to a different room, do something calm and relaxing until you feel tired, and then go back to the bed and try again. The other issue with Karl that we're going to touch on is vitamin D. And vitamin D is very important for people with MS. We know that there's a relationship between a person's vitamin D level and their risk for developing MS in the first place. And once you have been diagnosed with MS, we know that maintaining a healthy vitamin D level actually helps slow down disease progression. So we typically get vitamin D through sunlight and through the foods we eat, but we may need additional supplements on top of that. And there's actually a lot of really interesting research going on right now. And we think that there's a genetic underpinning between vitamin D and MS, in that people with MS might have a gene mutation that actually makes us more susceptible to vitamin D deficiencies. So you can check your vitamin D level. Simple blood test. Normal is generally 30 to 100, and your MS provider is going to help you set a personal goal. So usually I try to keep my patients between 40 and 50, for instance, but we tailor that to each individual person. One thing that I also think is very important is that while having MS does not significantly increase your child's chance for developing MS, we also know that maintaining their vitamin D levels. So I usually tell people, start getting your teenagers tested, make sure their vitamin D levels are normal, and if they're not normal, supplement them. Because again, we see that healthy vitamin D levels decrease your risk of developing MS. The dietary sources of vitamin D include oily fish, egg yolks, dairy products. A lot of cereals and stuff are fortified with vitamin D as well. So now I'm going to give it back to Mandy, and she's going to kind of go over physical therapy and wellness for Karl.
Great, thanks, Stephanie. So while Karl's not having any specific challenges related to his physical mobility, he's clearly struggling to manage his fatigue and incorporate appropriate levels of exercise and physical activity into his life. So I actually want to start there. What's the difference between exercise, physical activity, and rehabilitation? So exercise is generally provided or prescribed by an exercise physiologist or a physical therapist. It's usually individualized to your abilities and may have some evolving parameters that help you maintain or gradually improve your physical health, and it's performed on a consistent basis. Physical activity, on the other hand, is all the other movement throughout the day that's beyond sitting. And rehabilitation is something that's very specific. It's very definitive. It has a specific beginning and a specific end. It's often used at diagnosis, with relapses, or with disease progression. And it often has the intention of recovery or maximizing a function or compensating for loss of function. So while Karl doesn't need rehab, a PT consult may actually be helpful for him. So on the next couple slides, we'll actually dive into some specifics that Karl can try to help him with exercise and physical activity. And next is fatigue management. So here's a guy who's clearly very exhausted and tired from work. He has probably very little, if any, energy for exercise at the end of the day. So I think it might be valuable for Karl to sit down with an occupational therapist who actually has a lot of expertise in the area of energy management and energy conservation, and see if there's a way he can reorganize his day to budget a little more energy for exercise later. And lastly, to kind of dovetail Stephanie's comments about the potential impact of exercise and physical activity on sleep. Karl's clearly not sleeping well, and there is some research that suggests that exercise can help to decrease arousal and improve drowsiness at night, especially if the exercise is done in the afternoon. So that might be something else that Karl would want to consider. So Karl specifically needs to work on exercise and physical activity. So we recommend a consultation by a physical therapist. So this doesn't mean 2 times a week for 8 weeks, but rather maybe 3 visits over the course of 2 to 3 months. So again, while he doesn't have any specific deficits, I would recommend an exercise program that's comprehensive, that includes aerobics, strength training, balance, and flexibility activities. I would also, as his PT, work with a workstation assessment relative to his ergonomics, his posture, and his positioning, and how that may be having an effect on his fatigue. And I'll actually have a quick reference for you for that on the next slide, because sitting better may actually help reserve some energy for him. Conversely, strategic standing may also help him as well, as well, to help him incorporate some physical activity into his day. So a consistent standing program may actually help him improve energy, and we'll talk about that here in a subsequent slide. And lastly, but certainly not least, is the potential emotional effect that exercise could have on this young guy. You know, he's young, he's single, he's intelligent, he probably wants to feel stronger, more masculine, and I think potentially engaging him in more exercise and physical activity can truly help him feel better, maybe more confident, and improve his emotional well-being as well. So here is just a quick example with some tips for positioning at your workstation that may help to minimize fatigue. And certainly, like everything else in MS, it's unique to everyone. So ideal positioning for fatigue management is something you'll want to talk to your team about to confirm the best way for you. So I had to leave this slide in because I think it's quite funny. Incorporating physical activity into your life is often a choice. And this is an image of folks using the escalator to go to the gym rather than the stairs. So one way to incorporate physical activity is to stand more than sit. So some research suggests that the average American spends upwards of 12 hours a day sitting. That's a lot of sitting. So researchers have actually coined the term sitting disease to describe the ill effects of an overly sedentary lifestyle. And the consequences of sitting potentially too much are increased risk for cancers, type 2 diabetes, obesity, among the other things we have listed. And they've started to demonstrate that standing can help to reverse some of those risks and improve some of those challenges. However, unfortunately, exercising that recommended 150 minutes of moderate exercise per week doesn't compensate for that inactivity. So those little bouts of physical activity really do count. So some ideas of how to incorporate physical activity into your day would be maybe park the car further away to walk, maybe stand during commercials on TV, or ask your boss if you can get a standing desk at work. I know I have a number of clients who their employers have helped pay for standing desks. Dance in the car at a stoplight. I have 2 kiddos and we're always kind of wiggling around at the stoplights. Movement alarms, use your smartphone for other purposes. Set some alarms to remind you to stand, move, stretch, do a little bit of exercise. And for our wheelchair users, maybe doing some isometric exercises, which are exercises that can be done where you engage the muscle and contract the muscle, but don't take it through a full range of motion. That can still be great for strengthening. Maybe doing some weight shifting or using standing frames. But ultimately, you need to strategize with your healthcare team, specifically your physical therapist, to kind of balance that right amount of movement to improve energy and to improve your overall mobility without causing that unnecessary undue fatigue. And I'm going to pass the baton now to Peggy, who's going to talk a little bit about emotional well-being.
Thanks, Mandy. And I have to say, I'm really glad to be talking about emotional well-being, particularly since 69% of our audience in the feedback question said that they thought Karl really should be addressing his emotional well-being. So I totally agree with them. We know that mood issues are very, very common in MS. And if you think about that, in a person's lifetime with MS, 50% of people, at least, are going to experience a very significant episode of depression. And keep in mind, this is 3 times higher than the general population. So it's very common. And in MS, if you have problems with your mood, it can be related to the disease itself, it can be related to medications, and steroids are kind of known for this, but also just changes in life circumstances. And if you think about Karl, he's had some pretty significant changes in his life in the last 3 years with being diagnosed with MS. And who knows if he's had problems or issues with change in his legal position, his job, that sort of thing. But when people are depressed, anxious, moody, irritable, which is common in MS, it has all kinds of consequences. If you think about having a relatively stable mood, that sort of is a buffer for coping with stress. And when you have mood problems, that buffer is taken away. So you experience stress more significantly. Sometimes when people are having problems with their mood, they engage in unhealthy behaviors. They eat unhealthfully, they smoke more, they drink more, they shop more. In Karl's case, he's not going to the gym, he's not spending time with friends. So they can have difficulty taking care of themselves and others. And I think, Karl's definitely having some difficulty taking care of himself. They may lose time from work, they're more difficult to get along with. So folks who are depressed and really anxious are tough to live with. They notice changes in their sleep patterns. And I think, as Stephanie said, Karl's having so much difficulty turning his mind off at night that he can't fall asleep. That's a pretty typical sleep pattern for anxiety. When people wake up early and can't turn to sleep, that's pretty typical with depression. And many people have both anxiety and depression at the same time. And also, people cannot function as well cognitively, which is a significant issue for anybody with a mood problem, but particularly if you have MS. Next slide, please. Okay, so the reality in MS. Depression is underdiagnosed. In part, this is because some of the symptoms overlap with symptoms of MS. So if you look at things like fatigue, you look at cognitive difficulties, those things can coexist in depression and MS. So sometimes people mistake fatigue in MS as MS related and not depression related. And as a result, depression is undertreated. People may not report that they're feeling depressed and anxious. This is not so easy to acknowledge. And the other thing is that sometimes healthcare professionals just don't ask about mood. Depression also can make other symptoms feel worse. You experience them more significantly. As I said, cognition, pain may feel more severe, and certainly fatigue. Depression can be life-threatening, so it's very important to address this for all people, but here we're talking about Karl, because the suicide rate for people with MS who are depressed is significantly higher than the general population. And regardless of the cause, depression responds well to treatment. And the recommended treatment is psychotherapy, having someone to talk to, a professional, plus antidepressant medication is often indicated if the depression is moderate to severe. That's the treatment of choice. And exercise also helps mood. Next slide, please. We talked a little bit at the beginning about spirituality, but I wanted to just say that MS can clearly challenge resilience and spirituality. And if you think of resilience as the ability to bounce back from adversity or difficult times in life, and it includes persistence, flexibility, resourcefulness. My guess is that Karl has been a pretty resilient person. He got through law school, he's working, he's dealing with MS, but it's being challenged at the moment. And spirituality, as we said, is very individualized, but it often is that aspect of life where people are concerned with human spirit, non-material values, the meaning of life, trying to keep their life in balance. And spirituality is part of what supports personal development. It is staying connected to yourself and to other people. That is part of spirituality. And both of these things have shared goals of adaptive coping and living with purpose in the face of challenges. And I would say with passion as well. Okay, now we are going to give you some examples, as we said, of SMART goals. So we're starting with Karl. And keep in mind that SMART means specific, measurable, attainable, relevant, and time-based. So here are Karl's SMART goals. I will call my MS provider this week, the time-based, to discuss my mood and ask for a referral to a mental health provider. Also, I want to make mention that in our article, there are resources for how to identify mental health providers who can work with people who have MS and chronic health conditions. Karl will ask his neurologist to check his vitamin D level at his appointment next week. So again, very specific. He will contact a physical therapist to gather information on an appropriate exercise program in a week. So those are Karl's SMART goals. And Mandy, I think you're going to introduce us to a support partner who has wellness concerns.
Yes, so I'd like to introduce all of you to John. John is a 52-year-old car salesman who is a support partner for his wife who has secondary progressive MS and is having considerable increase in her disability. They have 2 adult children, but they live out of town. John has considerable health problems himself, including blood pressure issues and diabetes. Both him and his wife smoke. He has ran out of prescription medications more than once, and he's not following up on his medical visits. He has stopped his leisure activities, specifically bowling with his friends. Overall, he just feels really stressed out, frustrated, and guilty. So John's having some challenges. So just like we did with Karl, we're going to answer a polling question, because just like people with MS have wellness needs, support partners do too. So which dimension of wellness do you think John should address first? And I'll give you a moment to answer that. Great. So it looks like the majority of you think that emotional well-being and his diet, exercise, and healthy behaviors should be addressed first, both key areas for John. So we're going to start by discussing his physical therapy priorities. So his diabetes and blood pressure issues are a tremendous concern. You know, the consequences of uncontrolled diabetes can result in blindness, neuropathy, and even kidney failure. And regular exercise can help improve blood sugar control because that muscle movement leads to greater sugar use within the active muscles. So the guidelines for people with type 2 diabetes for aerobic exercise is 150 minutes per week, 3 to 7 days, with no more than 2 consecutive days without exercise. Now, exercising with diabetes doesn't come without some precautions. Those people who are diabetic who take blood sugar lowering medications need to be cautious about the timing of their exercise relative to their medication. Medication taken too closely to exercise can result in too low of blood sugar. And sugar should potentially be monitored, especially initially before and during exercise. It's also important to take the precaution of having a fast-acting carb source nearby in case the sugars do drop too low. This gentleman too might benefit from some physical activity and decreasing sedentary behavior recommendations like we provided to Karl. So some of the ideas for standing more than sitting may be also helpful for John. And the next thing we would talk about in PT would be some back strengthening exercises, because I think it's important for him to sustain his ability to protect his own back health for his ability to continue to help his wife. So the big message is physical therapy can be for the support partner too. It doesn't just have to be for the person with MS. PT evaluations are often covered by insurance, and for John, this is a good, safe starting point for him. It would be a thorough, individualized environment where he can learn how to exercise within his abilities. So again, within PT, we would maybe identify some core strengthening and endurance exercises like the 2 pictured here. We would talk about some aerobic exercises. And we would also talk a little bit about some body mechanics and proper lifting and transfer techniques to, again, protect his own back health as his wife continues to progress. So this slide shows just some images and some examples of body mechanics and lifting techniques. The first one is a basic pivot transfer, and this is the upper left-hand corner. Using a wide base of support, the support partner is using a gait belt, bending at the knees and the hips, and moving or pivoting your feet to turn rather than twisting at the back. The upper right-hand corner is an example of how not to perform a floor to stand transfer, and then how to perform one using a gait belt. Now, clearly, there are many different ways to perform any of these transfers. So again, I would encourage you to talk to your physical therapist if these are types of transfers that you want to practice or you want to be able to improve upon. But the key message with either of those 2 transfers is the use of the gait belt, and that's that image in the lower left-hand corner. That gait belt is important to use because pulling or tugging on the arms or the shoulders could result in any injury to the person with MS as well as the support partner. And the goal is to complete the transfer easily, efficiently, and safely. And lastly, I wanted to throw in that other image on the lower right-hand corner. That's a device that I think is somewhat underutilized. It's a sliding board, and it's a device that can be used to help with transfers from a wheelchair to a chair, a bed, maybe a toilet, but the person with MS can scoot between those surfaces with or without assistance. So now that we've chatted about some physical needs, let's talk about some of the emotional needs that this gentleman may have. So I'll pass it on to Stephanie.
Yes, and this is something that I feel very strongly about because I see this every single day where the person with MS, obviously we're there to attend to their needs, but the support partners tend to ignore their own health, and they tend to get a lot of diseases that can be easily prevented with wellness, right? So just as Mandy was saying, diabetes, hypertension, even some types of cancers, we can prevent that from happening. But if you ignore your health, then the support partner tends to have a health crisis and need to be hospitalized or need emergent surgery, and that takes them away from their loved one. Right, so your health really deserves to be a priority. Don't ignore it, and please pay attention to yourselves just as much as you do for your loved ones. With that being said, on the next slide, primary care is so important. It should be an essential part of every single person's health. If I could just get the next slide, please. While we're waiting for that slide to advance, it looks like it might have gotten stuck. But basically, routine primary care, it's an essential part of everyone's health, right? And that includes vaccines, getting your annual physicals, so you should be seeing your primary care doctor at least once a year. And it also includes gynecological care, prostate exams for men, and any other age-appropriate screening tests. Now, the overall goal of routine primary care, as I said before, is to prevent and effectively manage other chronic illnesses such as heart disease and diabetes. Acute and chronic illnesses can negatively impact MS, so primary care should also be a priority for John's wife. So it's really something they should do as a couple. Now, I'm going to get on my soapbox about smoking. So in the scenario, it said that both John and his wife are smoking more than usual. And abstaining from tobacco should absolutely be one of their top priorities. For the person living with MS, exposure to smoke firsthand or secondhand can increase the risk of disease progression and disability, and it can also increase the risk for developing antibodies against some disease-modifying therapies, including interferons and Tysabri. So what that means is that exposure to cigarette smoke can actually make it more likely that your disease-modifying therapies don't work and that you relapse and continue to progress, and that's really scary. The good news is quitting can reverse these risks, so come up with a plan. And I recognize that this is something that is way easier said than done, but the fact that they can do this as a couple and come to their healthcare provider with the goal of quitting and come up with a plan that they can keep each other to is actually a really good thing. So now I want Peggy to kind of take it from here and talk about what they can do to promote their emotional well-being.
Thanks, Stephanie. I think it's pretty clear from our description of John that he's feeling incredibly stressed, and his energy is really distributed across a lot of different areas. And so one of the things often I recommend to people, and if I were talking to John, I would say, let's make a list. Where is your stress coming from? And sometimes it's interesting that what we think is going to be one of the top three, or the top stressor, really isn't. So it's important to find that out from people. What are you feeling stressed about? And then also, how is stress affecting you? And it can affect people physically, mentally, emotionally, and behaviorally. And I would say that at this point, all of those areas of John's life are being affected by his stress. And then it's important to focus your efforts on stressors that you can actually change, that you can do something about, and that those that occur more frequently. So it could be John's wife's secondary progressive MS. It could be maybe she's falling. It could be his job. We don't really know. But then seek out information and resources, generate multiple options and possible solutions. And I think Mandy and Stephanie both gave us lots of possibilities of information and resources that might be helpful to John and his wife. Utilize your support system. At this point, part of John's support system is missing because he's not bowling with his friends. Make a healthy lifestyle a priority. This could be for both of them, as Stephanie said. And it's really important to allocate time for relaxation. Downtime alone and with others, one of the things that we tend to see is that support partners stop taking their own downtime, their own rest and relaxation time, and feel they need to be with the person with MS when they're not at work. And practice specific skills. I always say to people, with you at 24 hours a day is your body, your brain, and your breath. So even taking one slow, deep breath at a red light can be helpful. Next slide. Effective communication. This is clearly one of the things that I think would be helpful to John and his wife in their relationship. And it's very difficult, even though everybody knows this is a primary ingredient in a healthy relationship, to make it a priority. To set aside that time to let the other person know that it's really important you want to talk to them. And having accurate and shared information so that you're really talking a common language. And that might be some of the information that we've already heard about for this couple. Using both active listening and speaking skills. Sometimes when people think about communication, they think it's just what we say to the other person. And in fact, being a good listener is incredibly important. Paying attention to tone and body language. You know, John's pretty frustrated and stressed at this point, so it would be important for him to pay particular attention to making eye contact with his wife, asking questions, summarizing, making sure that they understand each other, to check out assumptions versus trying to read her mind or having her read his mind, because people, no matter how long they've been together, are invariably inaccurate with this. And respecting differences in coping and communication styles, because people, even though they love each other and have been in close proximity for a long time, often do things quite different. Some people are talkers, some people are not talkers. That's just one example. So now we're going to show you some SMART goals that John might set for himself on the next slide. So I will use a gait belt and good body mechanics for the guidance of a physical therapist, in this case Mandy tonight, during all bathroom transfers in 2 weeks. This only improves safety, helps him feel that he's doing a better job, and probably increases wife's confidence in making these transfers. I will schedule a communications date with my wife on my next day off. This is one of the ways of making it a priority, to actually schedule it, because it says to each other that this is really important. And I've had couples that have been married 30, 40 years do this and say it's made a huge difference. He's going to do that on his next day off. And I will cut back my smoking by 4 cigarettes a day by February 1st. So a number of SMART goals that might fit for John in pursuing his wellness. Okay, now we're going to introduce you to one more person. This is Valerie, another person with MS. She's 45 years old. She's married with 2 teenage children. Her MS was diagnosed 11 years ago. And after much thought and deliberation, she left her teaching position last year. She loved being a teacher, very dedicated to her students. But she did this because of increased fatigue. She just didn't feel as sharp as she wanted to be or needed to be as a teacher and do the job in the way she wanted to do it. And she had several falls, which was very concerning to her, her students, and also other personnel at the school. She's been trying to establish routines and organization since she's been off work. She's just really not having much success. She was really hoping that things would just automatically get better by not working. She spends a lot of her time napping on the couch, so she's really not getting much done. And both she and her husband are feeling overwhelmed, ineffective, resentful, and lonely for each other. I think we have another question for you. So which dimension of wellness do you think Valerie should address first? You take a minute and answer that question for us. Okay, so we have almost half of you saying that she should address her emotional well-being, and certainly I think that's always important, and then relationships. So again, the rest of it's pretty evenly distributed with the other 50%. So I noticed that only 8 people said to address her cognitive well-being, but I want to talk a bit about cognitive health and MS, in part because this is one of the reasons that Valerie left her job as a teacher. Was extremely important to her identity and her feelings of self-worth. Like mood problems, cognitive changes are very common for people with MS. About 60% of people with MS will develop some cognitive changes over time, although a lot of those will be mild in intensity. Multiple cognitive functions can be affected: memory, and usually this is short-term memory, speed of information processing, so people are just feeling like they're thinking a bit through molasses or listening to a conversation in sort of in a slowed down way. Attention and concentration, so this is why distractions are particularly problematic. Verbal fluency, meaning getting out what you want to say, that tip of the tongue experience. Visual spatial abilities, which is not really a visual problem, but it's that the information your eyes send to your brain kind of gets scrambled. So this is partly what interferes with pulling your car into the garage and not taking the door off, backing up accurately, finding things in the refrigerator, that sort of thing. And problem solving, decision making, what we call executive function. It is important to know that there are some cognitive functions not affected by MS, and these include general intellect, so IQ is really what I'm talking about, and long-term memory. So this is why people with MS invariably can remember where they lived in the 2nd grade and their 4th grade teacher and that sort of thing. Cognitive changes and fatigue are the most common reasons, including for Valerie, that people leave the workforce early. It's not because they can't walk or they need to use a wheelchair or they're having difficulty with their hand function. It is for cognitive changes and fatigue. Many factors, including mood and sleep, can contribute to cognitive difficulties and be affected by these changes. So when people aren't getting enough sleep, clearly it's going to be very hard to concentrate and do a job well and think clearly. So how do you pursue cognitive wellness? Well, there are cognitive evaluations and screenings that can be done with neuropsychologists, occupational therapists, language and speech pathologists, all depending on who's available or where you go for care. One of the real benefits of having an evaluation, particularly with a psychologist or a neuropsychologist, is that your mood will also be evaluated so that you can sort out what's depression, what's cognitive change. This is particularly helpful if people are thinking about leaving a job or applying for Social Security. Also, being on disease-modifying treatments is something that seems to really help people's cognitive status. And regular use of compensatory strategies, so notebooks, lists, organizers, time and energy management, and being a consistent person and following routine. So doing things in the same way, writing down an order of things you want to do in the morning hours could even be helpful. Stephanie, I think you're going to give us some ideas for how Valerie might manage her fatigue.
Yes, and I know fatigue is an issue for a lot of us. I have MS. I was diagnosed when I was 25. So in addition to treating it as a clinician, I know what it's like to come home at the end of a day and just be too wiped to even think about eating right and exercising, and it's really overwhelming. And I know personally, the last thing I want to do is, after having a tough day is come home and cook myself a healthy meal and go to the gym, right? So we really want to pay attention to our fatigue. And fatigue can be caused by MS, but there are also a lot of other things that can contribute to fatigue. So there are a lot of strategies that we can use to kind of control fatigue if it's an issue for you as well. And some of those things might include adjusting medications that can cause fatigue. So that might be, for instance, muscle relaxers. Sometimes taking them throughout the day will make you really fatigued. We're definitely going to look at your sleep quality and see if there's this undiagnosed sleep disorder. And we will come up with a diet and exercise plan that works for your life and around your schedule. And we can also rule out other health problems. For instance, thyroid disease can cause fatigue. And we can also, as a last resort, if none of those kind of lifestyle interventions work, we can talk about medications that can help boost your energy levels. And I wanted to take a minute to talk about naps. Now, they don't replace a good night's sleep, but a brief 20 to 30-minute nap really can help your alertness throughout the day. If you take naps that are longer than that, it can actually make you feel groggier and defeat the purpose. And you also want to be careful not to nap too late in the afternoon because then it will interfere with your sleep cycle at night. Now, diet is a huge issue, so I definitely wanted to take some time tonight to talk about that. Yes, we know, obviously, obesity can worsen MS and decrease the overall quality of life. And Laura, if I could just have the next slide, that'd be great. And while there is no one specific MS diet, we are doing a lot of research right now. There's a lot of really interesting research on the gut microbiome. We're taking a look at the Walls Protocol and paleo diets, which some of you might be familiar with, and seeing if they really do impact MS in any way. We have a lot of data that says eating healthy does help with your energy levels and your symptom control. But really, you know, I kind of caution people not to go overboard. We want to make sure that we're eating healthy and that we're treating our bodies right. But it's also important to have a healthy relationship with food. And more, I'm seeing people become so overwhelmed with information, and then they feel really guilty and they're ashamed of how they're eating. I just had a patient in my clinic last week who had a relapse and was convinced it's because they slipped up and let themselves have a bowl of ice cream, right? And so, you know, you don't want to be restricting yourself, because I see people restrict themselves and really make themselves and their loved ones miserable. So having a healthy diet, but also a healthy relationship with food is something that I think is really worth mentioning. Now, in general, healthy diet. So really there's nothing that you should never, ever eat, but high sodium, high sugar processed foods, those you definitely want to limit and have on the rare occasion. While fruit and vegetable intake should be something that we get a lot of every single day, we're going to try to choose leaner proteins like chicken, turkey, fish, as opposed to red meats or really fatty meats. And healthy fats include nuts, seeds, vegetable oils, and oily fish that has a lot of omega-3s. Consuming plenty of fiber and hydrating, it keeps your muscles healthy, keeps your GI tract healthy. But really the overall theme is that, you know, everybody is individual, right? We all come from different cultural backgrounds, right? I'm Irish Italian, so you try to take my carbs away and I don't know what to do with myself. Whereas other people might feel really great on a gluten-free diet. Everybody's different. So if you're interested in a diet or you want to try something, give it a month. If you, at the end of the month, feel better and it's something that fits with your lifestyle, then go for it, embrace it. And if you want some more specific questions, ask your provider, because there are a lot of other health conditions that we have to consider when recommending what diet is best for you individually. So Mandy, can you kind of touch on some of the physical therapy things that Valerie should be paying attention to?
Absolutely. So from a physical therapy standpoint, Valerie's first priority, in my opinion, would be fall risk reduction. And we'll actually talk about how balance works in greater detail in the next slide with an image. So I think making this a priority is our first and foremost area of emphasis. Secondly, we would want to talk a little bit about assistive devices. So I think it's important to encourage people to rethink the use of assistive devices as taking charge of your MS and not giving into your MS. People often say, well, this just means my disease is progressing and now I'm giving into the disease if I decide to use this device. I would encourage reframing that thought process a little bit, because an appropriate assisted device, whether it's a cane, a walker, or a wheelchair, will actually help you to expand your world and make your current mobility better. And to be quite honest, if it doesn't do that, then it's probably not the best device for you, and we need to keep investigating. And I think it's also important to note that it's okay to have more than one assistive device for different environments, maybe different situations or different times of day. Maybe a cane in the morning is fine, but a scooter in the evening when you go out to dinner with friends or family is what allows you to be safe and enjoy your evening, and that's okay. I think it's also important to note and to consider how falls impact the family. I think feelings of fear and hesitancy to do things, or feeling like you're isolated because you don't want to have your loved one fall or the person with MS fall, those feelings can exist. And I think it's okay for both the person with MS and for the support partner to say, hey, you know, I want us to use this assistive device, or I want us to use this tool to help both of us, to help all of us be able to do an activity together safely. So these devices, you know, usually unintentionally often help to improve relationships. The third bullet point there talks about fatigue management, and we've already spoke about this a little bit, but I do think it's helpful for Valerie to recognize what is her primary fatigue, which is fatigue caused by the disease process itself, and then the secondary fatigue, which is that fatigue caused by other challenges like what Stephanie mentioned, including inadequate nutrition, or maybe poor sleep hygiene or deconditioning that she has, and then addressing those issues with the team so that she can optimize her energy. And lastly, I think it would be good for for Valerie to be able to explore some exercise programs that she can do that is appropriate for her ability level, because honestly, we don't want her wasting her valuable energy on exercises that don't truly optimize her mobility. So as promised, we talk a little bit more about balance. So let's dive in a bit into how balance works in our bodies. Balance includes both motor systems and sensory systems. And within the motor system is the muscles and nerves. So this is the muscles and nerves having sufficient range of motion and sufficient strength for balance, as well as the nerves communicating with those muscles and telling them how to be coordinated or how to be timed properly and sequenced properly in order to keep people steady. Now, the sensory systems that contribute to balance are our eyes, inner ear, and then the muscles and nerves in our legs. So our eyes refer to our visual acuity. Our inner ear refers to our the ability of our inner ear to communicate with our eye muscles to allow our vision to stay steady as we turn our head or we move our bodies. So often if that system or that pathway is interfered somehow because of lesions, people often describe kind of a bad home movie sensation or kind of shaking in your vision. So eyes help with balance, ears help with balance, and the last system, as I mentioned, are the muscles and nerves in the legs, or that sense of touch or positional sense from our feet and from our joints, and have that message be sent to our brain about balance. So how that's all kind of applied to real life is, say, the brain's input from the feet is compromised because of the MS. A really plush carpet or an uneven surface can really make balance challenging. And this situation could be challenged even further and complicated even further if it's a dark or a dim lit room, which in turn would compromise vision because of the darkness, and the feet and the input from the feet and the joints would be compromised. So it really creates a situation where there's a lot of reliance on the inner ear for balance. So I think the key message is, if you have troubles with balance, and in Valerie's situation she does, it's important to explain those situations to the PT so that we can problem solve together what areas need the most attention from an exercise management standpoint as well as a compensation standpoint. Secondly, I want to comment briefly on dual cognitive or motor task influence. There's some emerging research about the potential association between fall frequency and decreased cognitive function. So in the case of Valerie, working through some of those cognitive challenges that Peggy identified, as well as her balance challenges, is absolutely imperative for her. We also know, and this is pretty logically speaking, that generally falls don't happen when we're standing and thinking about balance, which is unfortunately often how PTs prescribe balance exercises. It happens when we are talking and walking, or when we're turning too fast in the kitchen. So again, explaining those situations where you might feel unsteady or where you might have falls can help the physical therapist to create interventions and balance exercises that are individualized and targeted to those specific situations and challenges. So, in summary, the physical therapy strategies that she needs to engage in would be balance exercises, like we spoke about. She needs to consider the environment, such as the surfaces, maybe the lighting, positioning objects so that they're convenient and she doesn't have to reach great distances to access them, and assistive devices. It would also be important for us to talk about fatigue management with her and maybe engage our friends in occupational therapy to talk about the 4 Ps of fatigue management. And the National MS Society and Can Do MS has extensive information about fatigue and how to manage fatigue. But in short, those 4 Ps stand for planning or organizing the day, that require, or organizing your day and the activities in a way that the activities that require the most energy are done when fatigue is minimal. Pacing is providing yourself with that intermittent and strategic rest during the day so as not to overdo. Prioritizing is selecting those activities that must be done first and excusing yourself with the others that can wait. And then lastly, positioning, which refers to kind of budgeting your energy by considering your body position, which kind of goes back to a little bit like what we talked about early on with our first gentleman, Karl. And lastly, I think to help this gal engage socially, since she was a teacher and enjoyed that and enjoyed being around people, students, and her colleagues, she may want to consider a telehealth exercise class or some type of online interactive group exercise class. And there's actually one online that I would recommend called msforward.org, which you can go and participate in an online interactive exercise class from your home, or you can watch it archived if for some reason the time doesn't work with your schedule. So we'll wrap up Valerie with her final SMART goals. We have 2 for cognitive wellness, and then the final 2 are for diet, exercise, and healthy behavior. So tomorrow morning, I will write down 2 or 3 routines that have been effective in the past. Helps with cognitive wellness. And the second one is I will contact my MS provider by Friday about specific cognitive concerns and consider possible assessment. I will prepare dinner at home 5 days this week instead of eating out. I need to make that my own personal goal. And lastly, I will use a walker for all mobility in the home after 4 when my fatigue intensifies to minimize my risk for falls, to be accomplished in 1 week. So, as we unwind for the evening, during the past hour, we have been happy to share with you and problem solve with you and hopefully illustrate for you how the whole team works together to improve wellness. We hope this time has given you the opportunity to kind of pause and reflect on your own individual wellness needs and how you can improve your overall health. And in conclusion, we wish you all a very well and very healthy 2018. Thank you so much.
Well, I want to thank Stephanie, Peggy, and Mandy for some terrific information. And we do have some time for some Q&A. So I want to start out by asking Peggy, if you could talk about how to make this a lifestyle change? In other words, how do you stay committed to the lifestyle change and implement these as not just a short-term, but really a long-term endeavor?
Okay, Laura, I think, this being the beginning of the year, probably all of us are facing this to some extent. And I just got something, being of age today, from Silver Sneakers about a whole program for January of things for people to do every day. And I think what I noticed was that they were really setting smart goals. They were giving some great examples. And I think that one of the things that helps people stay motivated and make this work is to, ahead of time, anticipate some of the challenges, like what's going to get in the way, what's going to make this difficult. And I think sort of upfront, knowing that other people are going to get in your way. So you may be planning to go off to an exercise class, or you may be planning to go do stretching for 10 minutes and somebody says, yes, but I need you for thus and so. And I think being clear with people that this is a priority for you and that you'll be happy to help them when you get back from your stretching session. But I think also to sort of do what Mandy just said, and that is pick the time of day that is most likely to result in success for you. So don't pick the time of day to do one of these behavioral changes where you know you're horribly fatigued. The other thing is, I think it's often helpful for people to think about doing things for a period of time instead of a whole task. So in other words, sometimes I've said to people, you could do something for 10 minutes. Don't worry about completing your whole cleaning project or your whole meal preparation, but just prepare the ingredients that you can in 10 minutes, and then later you go back and you do another 10 minutes, and you add those together and you have a healthy meal at the end of the day. So I think sometimes people just need to take a little bit of a different approach. I also think it's helpful to team up with another person who is also trying to pursue wellness goals. And it doesn't have to be someone with MS, because most people we know are trying to do this. And so by talking to people about your plan out loud and then checking in with each other kind of keeps people on track, keeps people honest. And I think these are some of the things that we have in the article, the online article, about the common challenges to anticipate and then how to cope and manage the challenges after you've anticipated them. All of those things, I think, help people be more successful.
Stephanie, Randy, did you want to add on to that?
I was just going to comment, too, that when those hiccups do come along, because they do come along, that it's okay to reach out to your team, to your team of healthcare providers, and have them help you get back on track. And again, it doesn't have to be any one specific team member. Just tell someone, and they will get you connected with the right people to help you out. So again, we can refer to one another even if we can't directly help the specific challenge.
Stephanie?
Yeah, and I would just like to really emphasize, come up with SMART goals for yourself, meaning that it has to be something personal for you, but also attainable, right? So taking smoking as an example, don't expect to be able to quit overnight. Set realistic goals that you're going to cut back over time. Find somebody, a support partner, a friend, somebody who can also help you reach those goals and keep you on track.
Great. Peggy, we've received a lot of questions related to intimacy. Would you like to address this?
Sure, I was really struck by that on the list of questions that people sent in ahead of time. And intimacy is just such an important issue for all human beings, but it's often one that comes up for people with MS. And I think that, if you think about how does MS have the potential for affecting intimacy, it has a direct effect, so just as people can have numbness or tingling or difficulty functioning in arms and legs, this happens with the parts of the body that are involved in being physically intimate. And And so we're also talking about emotional intimacy here, but often what people come to us with are concerns about physical intimacy. So there's a direct effect of MS. There's also secondary effects, so that if people are very tired or people are having spasticity or bladder problems, then that can affect intimacy. So people have one, accident, bladder accident, when trying to be intimate, and that may turn into years of not being intimate. There's also sort of a third level ways in which MS affects intimacy, and that is that people lose self-confidence. Their self-esteem goes down. They don't feel that they're capable or that they don't feel they're attractive. And I can give a really quick example here. I saw a couple once. The woman had MS, and they were a very loving couple. Clearly, they were very committed to each other. All the kids were out of the house, so they had the perfect opportunity, they said, to be intimate, but they hadn't been for 3 years. She thought it was because she was now physically unattractive and had gained a little weight, and he didn't want to approach her because he knew she had bad spasms and he didn't want her to have pain. So this gets back to the primary issue in intimacy is communication. It all starts with communication. People just need to start talking about it. And that did the trick. I saw these people once, and they turned the corner and never looked back. So people can acknowledge how difficult it is to talk about this. And sometimes I have said to people, each of you sit down, make a list of what are your concerns, your intimacy concerns, physical, emotional, whatever, and then exchange those lists. And in some ways, people are often pretty surprised, and often people are reassured that their partner is having similar concerns. So that you just need something to kind of get the process started in a new direction.
Stephanie or Randy, did you want to add anything onto that?
No, I would just refer to an outstanding psychologist like Peggy if approached with this challenge.
But I do think this is another example where various people on the team end up having a role. So if people are having spasticity and bowel and bladder problems and whatever, I would refer to Stephanie. So,
Absolutely.
or to Mandy for stretching and working with the spasms and how to help each other stretch and whatever. So I think kind of everybody working in MS has something to bring to the table, but mostly the person with MS has the most valuable stuff to bring to the table.
Is exercise recommended during the exacerbation, or is rest better? Did you want to address that, Stephanie?
Yeah, so usually during a relapse, it really highly depends on what kind of a relapse it is. I usually say for people to take it easy for up to 6 weeks, let the body recover. It's going to be something that really is individualized. However, even during a relapse, I highly encourage people to continuously stretch and do low impact things, really tailored to, like I said, the symptoms of the relapse. And once they're ready to get back into things, working with PT, especially in the initial period of time, is going to be the right way to get back to what you're doing. Would you agree with that, Mandy?
Yes, that was very well said. It's incredibly individualized and often involves the collaboration of the nurse and the neurologist as well as the PT to kind of find that optimal amount of exercise during that difficult time.
Great. Well, it looks like we are just about out of time. Mandy, would you reiterate that website that you discussed? I think it was msforward.org. Can you talk about that just for a second? We had a couple of questions about that.
Yeah, so that's actually a local organization. I'm out of Nebraska. It's out of Omaha, Nebraska. But msforward.org, if you go to the website and you click on the telehealth classes, you can, like I said, watch either archived exercise classes, usually it's strength training, some flexibility exercises, or you're able to participate in a live class. So both, like I said, are helpful depending upon your schedule and your ability to engage in any of those classes. So it's a great resource.
Great. Well, again, I want to thank Stephanie, Peggy, and Mandy for some great information tonight. And as we conclude, I will encourage you to utilize the Can Do MS website for our e-news, our Ask the Can Do team ability to submit questions. We also have a great library of articles, including the article that was written by Stephanie, Peggy, and Mandy, which has some great resources that touches on the topics that we discussed this evening. I would also like to talk about some resources available from the National MS Society. They do have a variety of brochures, such as the Wellness Discussion Guide, which is a great resource which I would encourage you to download. That will be included in the follow-up email that is going to be sent out by the end of the day tomorrow. And they also have video segments that can be accessed on their website. The next presentation in our webinar and telelearning series will be on Tuesday, February 13th. It's going to be at the same time, 8 p.m. Eastern Time. And again, the topic is intimacy and MS. I would encourage you, if you would like to text to donate to help support our webinars, to dial 970-626-6232, and you can text to donate. And for those participating live tonight, you will see a survey appear on your computer screen. Please take a moment to complete the survey and share your input. Your feedback helps us to continue to improve our webinar series. So thank you for joining us. And again, the resources that we talked about, a copy of the slides, as well as the library article and the Wellness Discussion Guide, will be included in the follow-up email that we send out tomorrow at some point during the day. So thank you for joining us, and have a great evening.